Now, can you remember the anterior teeth in the maxilla here are close to the buccal side rather than the palatal. خفف من slow side. إذا the buccal side here is close to the anterior teeth. If we compare this to the palatal side. Therefore, the normal direction tooth adjacent is for the buccal side, remember. Why? Because it's close to the... نشيل الموبايل بالأخير لو سمحتي. موبايل مرة ثانية لبرا. Okay? Therefore, the normal direction is for the buccal side. So remember here your table here. The central is a conical shaped cross section. يا محاضرة يا كلام. Is a conical circular section, so the movement will be like rotation. Exactly. If you go to the lateral here, the lateral is buccally and gentle rotation again because it's an oval cross section. The canine, as I said, it's yes, it's a big one. So triangular cross section. Triangular cross section. The first premolar, as we said, is the only one to be pulled out. Second premolar buccal. So buccal distal lingual for the first molar and second molar. And here for the third molars, if you remember, very valuable. So it depends on your really experience and the location of the third molar. Now, if you move to the mandible here, see, the mandible has a higher ratio of cortical than cancellous bone. Where? In the maxilla. So who's denser? The mandible, exactly. But see here, the buccal and the lingual cortices here are equal distance here from the anterior teeth. So if we go now distally, the second and third molar, the buccal bone is here thickened by the external oblique ridge. So if there's a thick bone here, so the exact movement مرة واحدة نتكلم يعني مو معقول الدخول اللي متأخر من خلف وإلا بغلق البابين ممنوع الدخول يعني. This is very important piece of information for you. Just put it in your mind. That's it. Direction for movement mandible teeth. Remember the central lateral. We have a thin cross section, thin oval. So again here buccolingual, canine buccolingual because belong to the anterior teeth. So central, lateral, and canine. For the first and the second premolar, it's rotation because we have a round cross section here. And again for the molars, it's a buccolingual or lingual buccal, depends on the location of the third or the second and the third molar. But see here we have a figure of 8. Figure of 8, we have to do just like rotation, slightly 8 shape. Now, if we move to the deciduous teeth, you see here, first of all we have to put in mind the permanent bud here, permanent tooth underneath. So the underlying from the permanent tooth, fragility of the deciduous teeth, and carious crown. See here, we have carious crowns here. And of course, because of the limited opening of the child, so the axis will be restricted. So you have to take it care. So when we are elevating the roots of the deciduous teeth here, see very gently not to hit the crown of the permanent tooth. Exactly. See here now, when we are using the elevators. Now see here, if we have here a wide elevator and we have here a small distance between the alveolus and the tooth, here the force here, exactly why it will hit here the other side of the alveolus, so it won't be appropriate elevator in a very small space. Or the opposite side here. If you have a small elevator, exactly, so the more you give power, the more you are not doing the well or the exact extraction. Now the correct size here, exactly, see? Correct side and the position of the elevator, exactly we are elevating now the tooth from its socket.
Doctor, there's no effect if you use a small elevator?
No, if you use a small one here, like here, the more you put power here, it will be like, you know, you're doing nothing to it. So it'll be just no effect. See here, the more you put your power here, it will just, you're doing a force in the small, in a big socket. So when you give it an appropriate size here, see, it's elevating the root from the socket. Now, see here, if you have a curved root, see here, so you go to the right side, just to elevate it. Again, here, curved root, we go to the right side to elevate the root, and then we have a vertically placed root, so either side you can do it because the path, the removal path is straight up. Now, elevators. What are the objective of elevators? Elevators. First of all, so breaking down the periodontal ligament, of course, this is very important, breaking down the ligament, periodontal ligament, allowing the force at a more apical position or level, because when you're elevating, then if the next step using a forceps, it will be more apical placed, and of course, by elevator, you will expand the bunny's socket. And this is very important points. Now, see here, for Kublans,